Hello, this is Dr. Lywerenz at Longevity Health Institute. Hope this finds you well, and hopefully this enlightens you even more. But let me just catch you up to speed a bit. We're doing functional, integrative, personalized medicine here in Rochester Hills and in Madison Heights. And this fall, October, November, we will be in Bloomfield, and hopefully very soon even adding another practitioner. So we're always trying to expand. We have patients come from other states, far cities from here, northern Michigan. We do phone consults in other states and around the world, and happy to do so and keep spreading the word. So that's why you can share these with others, as people do, my patients do, and we can at least get them started on the line of personalized functional medicine and getting them dialed into what's really going on and how to fix things, and then they can take that to their area, and if they can find a doctor that can, then we can hand it off to them, all the better. So let me cover a couple things today because they came up, and I thought I'd just call this our common questions day. Today I had a lot of questions with patients, some of them funny, some of them not funny, but some of them real, and little tips I can give you. And I thought I'd cover those. But these are real things that you can address and add in your lifestyle or in your repertoire for health and wellness, weight loss, energy, etc. So one was a question about B12 and why give a B12 shot? Why do they need B12 shots? They got a very profound effect with the B12 shot that they had here in the office. And then they were steady with them, did a few, tapered off with them. We were doing one a week for a few weeks. And then they didn't have one for 3 months. But then when they got their next one, they got another big profound effect. Well, the reason is this: as we age, we lose this thing called intrinsic factor in our gut. And intrinsic factor allows you to bind and bring in B12. And there's some theory and some small studies that suggest that B12 actually, we can develop an antibody, so almost like an autoimmune type of reaction to B12, to this intrinsic factor component as a carrier. So it's very common with aging that we develop B12 insufficiency and sometimes even deficiency. And the plethora of symptoms are fatigue and neuropathies and numbness and tingling and slower brain function and cardiovascular risks. And there's more than 200 reactions in your body. But the question they had is, why do I have to get the shots? Why do I keep feeling the need to get the shots? Or why can't I take something orally? Well, the number one thing is you can't absorb orally, especially if you're aging in your 4th, 5th decade. You can't absorb as much. So a B12 shot typically, especially if it's your first one, has a pretty profound effect because you bypass your gut, you saturate the pools and the receptors, and people can notice that pretty remarkably. But after you've had that takeoff, after your first week or two, or after you have had a few, your liver actually stores B12. So you're going to get this trickling effect and release of it throughout the day, throughout the week, etc. So you may not notice that profound takeoff again or every week that you get a shot. Now again, it may deplete a bit after it's been 3-4 months. But some patients, what we do is we load them a shot a week for 6 weeks, and then we separate it by a month or two, and kind of as needed. B12 is water soluble. It is not toxic. There has been suggestion in European studies that excessive dose and use of B12 in cancer patients can be dangerous. But other than that, there's really no effects and side effects. And again, what you don't need or don't use, and you saturate your pools, you pee out. But we use B12 here very efficiently, very frequently. Patients love it, and we get some really, really good results. The second question I had was, I got asked about alcohol. This is actually a common question. What they can drink, what they can't drink. They know I'm kind of a realist and about balance, and they're going to socialize a bit, etc. And what's the worst? Well, unfortunately, I'm here to tell you, and I we all love the warm glass of wine, especially with fall coming, the red wine and that. But if you have digestive issues, if you have leaky gut, if you have candida, if you have issues related to heartburn and reflux, and I had a patient today even with a silent cough, excuse me, I'm sorry, silent reflux that had chronic cough. She has a neurogenic cough, and that's another topic I can cover with you. So working with her on that. But the wines, because they're so acidic and also high in sugar, they're going to really aggravate you. And there's even some trouble with wines that are actually going to lower your a lower esophageal sphincter pressure or tone, so that muscle actually can actually release a bit, and so your risk or your frequency of reflux and heartburn is going to go up. And so really that's the alcohols that are typically the worst. Obviously gluten-based alcohols, but alcohols that are high in sugar or high acidity, which unfortunately is your wines. Now, I know that's controversial and kind of contradictive too, because you hear the benefits of the flavonoids and resveratrol and how red wine is so cardiovascular beneficial, and that is accurate. But again, I'm saying when you're talking about GI issues, GERD issues, reflux issues, you got to be careful there, or at least really limit it or get off of it while we're working on your gut health for 6 months or a year, and really use it very limitedly. I do recommend patients when they do have a spirit or they have a special event, and I'm not a drinking advocate. I'm just saying is probably something like a gluten-free alcohol, like a Tito's vodka or something like that, is going to be much lower glycemic, less acidic, and give them less stomach issues and effects. So that was a question today that unfortunately that alcohol question comes up a lot. I had another question today about, again, we had got some advances on their hormones. They had lost some weight, balanced their hormones a bit, working on diet and that, but they kind of were stuck. And they were asking, look, I'm not going to do any heroics. They really need to lose about 60, 80 pounds. They're down about 20. And I said there's a few couple simple steps, couple things you can do that really can make a big difference, because I've seen this. And they're simple things. And you can apply them into your day and your practice every day. But it's about consistency and advancement in this. And that's two things. One is movement. Get moving. To burn calories, you either have to to burn fat, you need to either limit calories or burn more calories. So get active, move, get out of your chair, get out of the couch and move. Sounds simple. People will make this big issue of it and even say stuff like, well, I don't have time to go to the gym and all that. How about starting walking around the block, then 2 blocks, then 3 blocks? I have one patient here that had such a awesome result with her weight loss. And I commend her, pat her on the back, gave her a big hug, etc. Within like 6 months, she's down to about 60, 70 pounds. Obviously, we've done stuff with her, worked on her diet, worked on hormones, liver detox. But what she started, and this is on her own, she started walking a few blocks every day, not skipping a day, not a weekend or anything. She walked a few blocks every day. And she has a sedentary job, so she sits at a table at a desk at a computer all day long, and she recognized that non-movement was affecting her metabolism and her weight. Those 2 blocks became, in a few weeks, a mile. And every month her goal was to add another mile, and or something close to that. So essentially she had got up to walking 3 miles every day. She is down, like I said, about 60 some pounds, if I recall right. And she's basically escalated this movement up. And, she's motivated because she's getting a result, and she's a motivated person, even though she needs to lose a lot of weight. She recognized that non-movement was really, really harming and hurting her. Ironically, she's in love with this now, and not being sedentary. She'll do amazing, she already is. But just that simple adding a block by block by block, or a mile, and then a month later another mile, but every day committing to that movement consistency can make a huge difference in your weight and your health, okay? So that was another question. I told that story. I like sharing stories and good results with patients. And that was one that I shared with somebody, like, hey, let's just get off the couch, let's get moving, let's get a little active. You don't have to join a gym, you don't have to do any heroics. You hear me talk about high intensity training and things with athletes or people that are really active and all that. That's for later. Just get moving, get more active, get your steps in. I do believe in consistent steps, not the whole day. Some people say, well, I get 10,000 steps in a day. Well, that is great, but I think it's much better to get your mile in, or your mile and a half, or your 2 miles in of walking at one time. I tend to see better results with that. Another common question that comes up, and actually was brought up today, is what we do for Lyme, and how do we treat, and do we treat a lot of Lyme? And yes, fortunately or unfortunately, we detect and treat a lot of Lyme, and we have 2 therapies here that are the best in the world. And I know they do this in Europe. I have a couple patients that have actually gone over to Austria and Germany and actually had these therapies very successfully, but we do them right here at Longevity Health Institute. Now, I'll do a separate segment in the next week on Lyme disease, the detection and therapies, etc. But the 2 amazing effects on treatment, and literally I've seen antibodies, ELISA and Western blot tests for Lyme disappear, go to negative. So we cannot tell that they have Lyme anymore. And of course they feel completely different, energetic, no pain, etc. But that is ozone therapy. That's O3 therapy, ozone therapy, and also IV and whole body silver therapy, where we use silver ocular, silver orally, nasal spray silver, and IV silver. It's called Argentine 23. It's water soluble, very medically grade safe silver, but very, very, very effective. And that's treatment of Lyme. Hard to detect that disease. We always work on gut health. I practically never use antibiotics in chronic Lyme because of the side effects to the gut and antibiotic resistance, etc. But I will cover Lyme at another time in another segment, because it's unfortunately on the rise in Michigan and in the Midwest. And it's I'm sure there's people you know or you've heard of or in your family that have had Lyme. So the last thing a question is that what is the best thing? If there's one thing, what is the best thing that you can help me with sleep? And that is, in my opinion, and I see best results, is balancing your hormones. The one best thing. You get your testosterone balanced, you get your progesterone and estrogen balanced. If you needed melatonin, which is a hormone, you get that balanced. When your hormones are balanced, you will sleep like a baby. I had a lady sitting right in this chair right here today that has seen many doctors. She's about 60 years old, looks about 40, very preventative, very proactive in her health, works out all the time. Like I said, looks amazing, been on hormones, realized some of her hormone therapy wasn't working, so she just recently switched to us to get a different perspective and get her dialed in a little bit better. We got her progesterone tissue level balanced by checking her saliva. She has never slept better. She told me today in this chair, she has never slept better in her whole life. Not that she had a big sleeping issue, but she would get 5-6 hours and wake up okay. She gets 7-8 now and says it's just a different feeling. I feel refreshed, I feel revived, never had better sleep, and she's doing lovely. She's been with us about 2-3 months. So these are common questions and common results that we give, and they're very effective. I thought I'd share them with you. We'll have a separate segment coming up on Lyme, because I know that's a big topic. And I'll also share with you a segment coming very soon on CBD oil, the benefits and the positive effects, but how you have to be very careful with the quality of CBD, the full spectrum CBD, where you get it, how it's made, because that's super important. So keep educating you, enjoy it. I'm passionate about it. My staff is. My other practitioners are. We'd love to keep bringing you the best in functional and personalized medicine, and share this with others. This is Dr. Lewerenz. Be well.